Okay, so hi guys, it's chapter 14 lecture. So let me just get a few things situated and then we'll get started. I'm going to try to keep this under an hour so it's easy for you guys to watch on your own. Okay. So this is about dental charting. Real quick before we get started, I did locate some charting exercises that I want you guys to do. I put the due date at the end of the mod just because it's not on your schedule just yet. I can modify that to where it will be on your schedule if that will help you guys. But I will put it on there and I'll remind you too throughout the mod, the rest of the mod as well, but that it's due on November 16th. All right, so we're going to talk about dental charting, and in your book, it's page 291. Okay. So there are two basic areas of dental charting that are important, and that is the actual dental chart itself and the record treatment. We're going to start out by talking about the numbering systems, anatomic versus computerized, and geometric. All of these are different types of dental charting. So anatomical means the tooth chart looks exactly like a tooth. And a geometric is where it's just a circle that's separated into different sections where it doesn't actually look like a tooth. You can see some references of this in your mod packet. And then it's computerized as well. So you can have geometric computerized or geometric anatomical, and I'll show you some examples of those here in just a minute. There are several different numbering systems in dentistry. The one that we use the most is the universal or the national numbering system. That is where the teeth are numbered from 1 through 32, starting on the upper right side and ending on the lower right side. So we'll expand on that here in just a second. A little bit more, but the Universal, the Fédération Dentaire Internationale, FDI, and the Palmer, those are the three numbering systems. For the Universal, that one was established in 1968. Well, not established in 1960. The American Dental Association adopted this. It is currently the most commonly used here in the United States, like I talked about. Each permanent tooth has its own number, and it starts from the upper right and it ends on the lower right. So the upper right wisdom tooth is number 1. The upper left wisdom tooth is number 16. And then you drop down to the lower left wisdom tooth, which is number 17. And then the lower right wisdom tooth is number 32. So 1, 16, 17, and 32 are all wisdom teeth. All right, the Fédération Dentaire Internationale numbering system. This is, it was designated a long time ago. We don't really use this, but it can be easily used if needed, but it's more overseas. The numbers, I find it very confusing personally, but it's widely used in Canada and Europe. In 1996, the ADA adopted the system and the universal system for tooth monitoring, so it is recognized, but it's not something that's widely used. Each quadrant is assigned a number, and it's given 2 digits. If 2 zeros are notated, the whole oral cavity is designated. So that would be used like maybe for dentures or in different situations like that. We'll expand on this here in just a minute. You can see some pictures. And then the Palmer system is used very commonly in the United States, but mostly in orthodontics. Basically, it's 1 through 8. In each, there's 4 quadrants: upper right, upper left, lower right, lower left. And then numbers 1 through 8 in each quadrant. So they would number the teeth upper right 1 for number 8. And then upper right 8 is the wisdom tooth, which is actually tooth number 1. So that one's a little confusing, but we don't refer to the actual tooth numbers themselves in orthodontics very often, unless we are referring out for extractions of wisdom teeth or bicuspids or something of that nature. So if you're referring to another office who uses a different numbering system for like general dentistry or oral surgery, then of course we'll use that the number accordingly. For their numbering system, but in ortho, we use something different. Again, you'll see some pictures here in just a second on that. So here is the universal numbering system. This helps get a visual. So again, when we are looking at dental charts, tooth number, it's always going to be the opposite. So we have to get used to flipping things. So when we are looking at number 8 and 9, we have to remember those are the two central incisors. So the upper right, when we're looking at something, it will be our right, but it'll be the left for the patient. So when we're looking at a chart, we have to remember to flip everything. Okay, so our upper right is their, our right is their left, and their right is our left. So it gets confusing, but you'll get to where you can just do it without thinking about it. Okay, so here's an example here. The maxillary right molar, tooth number 1. So it goes 1, 2, 3, 4, 5, 6, 7, 8 is the central incisor, separated by the midline here. And then it goes 9, 10, 11, 12, 13, 14, 15, 16, 17. I skipped one, or 16, sorry. And then it drops down to 17 on the lower left, and then it goes all the way down separated to the midline. 24 and 25 so it's 8 and 9 on the upper, 24 and 25 on the lower, and then all the way back around to number 32. This is for primary teeth on the universal numbering system. So the upper right molar in a primary dentition is tooth number A, which when I first learned this, I thought tooth number A, that sounds kind of stupid. But that's just how they talk about it. So it's not tooth number A, it's just, but if you say tooth A, it sounds weird too. So tooth number A. So it's A, B, C, D, E, and then F, so it's A through J on the top, K through T on the lower. Because these teeth are replaced by the permanent teeth, which have different numbers. So they all have their own numbering system. Okay, so the FDI system for permanent looks very similar to the Palmer method, but the difference is the quadrants have numbers. So instead of saying upper right, they're going to say quadrant 1, tooth 1. So this tooth would be tooth number 1, 1. Okay. Or this would be tooth number 1, 4. And I think we watched a video, I think that was this class. I don't remember which video we were watching at the time, but it might've been my other class, but they were, it was tooth number 1, 4. He kept saying 1, 4, 1, 4. And I'm like, why is he doing that? Cause it also happened to be, or tooth number 2, I forget how it was, but it ended up being the same number in our numbering system as it was in what he was saying, but he was talking about it as one something. Anyway, it was interesting. But the maxillary right quadrant would be, so this would be 1, 1, 1, 2, 1, 3, 1, 4, all the way to 1, 8. Now, if you're talking about the upper left, then it would be 2, 1, 2, 2, 2, 3, 2, 4, 2, 5. So to me, that's incredibly confusing, just because that's not how we do it. But it is what you learn. Again, it would be the same for primary dentition, except for instead of 1, 2, 3, 4, then they move on for primaries to 5, 6, 7, 8. But we still go in a clockwise rotation here. So a clockwise rotation. So from the upper right, working all the way around clockwise. So for example, this would be tooth 5, 1, 5, 2, 5, 3, 5, 4, 5, 5. Okay, in the Palmer method, this is the one I was talking about with ortho. The maxillary right quadrant, okay, so we would term this, or how you would write it would be UR 1, upper right 1. Upper right 1 to all the way to upper right 8, upper left 1, lower left, lower right, and then the according tooth number on that one. I think this one, in my opinion, is the most simple. But I guess it's the one I've had the most experience with as well, because I've done ortho for most of my career. Again, for the Palmer method, it still is upper right, upper left, and this is the primary, upper right, upper left. So it's upper right A, upper right B, upper right C, upper right D, upper right E. Okay, so it's just A, B, C, D, E. The only thing you need to know is right or left, upper or lower. All right, so which system is most widely used in the United States of those three that we just talked about? and that would be the universal international, or the universal or national system for numbering. All right, so we're going to talk about cavity classifications now. Real quick, I'm going to show you this picture that just popped up from the book. Okay, so here you can see this is an anatomical chart here. And this is a geometric chart. So this is what I was talking about up here. It looks like actual teeth. You can see roots. You have the occlusal surface or the incisal surface visible. So if you wanted to just color in only the incisal edge, if you were charting it, it would be easy to make some very distinct marks on what is wrong with the tooth or what's going on. It's a little bit harder to do on a geometric charting. So if you're for this example here, they have it marked for, here's roots, and it has an abscess. So you have to just kind of draw the lines. And anyway, it's all a personal preference for the doctor and for the practice on which one will show up in your dental software and for which one that you use on a regular basis. Okay. So there are 6 different classifications for work or restorations that need to be done. Okay, so a cavity is, the word cavity itself actually just means a hole. Okay, caries means decayed tooth structure. Okay, so somebody says, oh, I have a cavity. They may not have an actual hole, but that's the term that we've come to know. So for example, you can have decayed tooth structure but not have a hole, meaning the tooth hasn't collapsed yet. There's just damaged tooth structure in there. Okay, so give me 1 second to get caught up because I'm not following the book here. Okay. So class 1, it's class 1 through 6 on the cavity classifications. Okay, so we need to know which one we are working with. All right, so class 1 is a filling that is developed in cavities and pit and fissures. All right, so these are pits here, or these are pits, these are fissures, and same in here as well. So these are grooves, little areas where there has been the development of the tooth where they come together and it creates a little indention, kind of like this. And the food and bacteria gets caught into those little areas, and that's when the tooth starts to decay because we're unable to brush it out properly. Or they're failing to remove everything the way it should be. So class 1 is only pits and fissures. All right, so if somebody's a candy sucker and they just let candy sit in the side of their cheek, and they suck on peppermints or butterscotches or maybe even gum, other things that have sugar in them, and they hold it in the side of their cheek, that's when you'll see those types of pits on the cheek side. This one is more probably of a and like a developmental or the actual shape of the tooth if they're having a hard time keeping it clean, and same for this one as well. Okay, and a class 2 includes the proximal or interproximal, so the in-between surfaces on posterior teeth, which those are the back teeth. Okay, so we have only the interproximal surfaces. All right, so here's an example of, we have a cavity here, but it can't be, so for example, that's where the cavity is, okay, but maybe we have to do a 2-surface filling in order to fix it. And the purpose for that is because we cannot access the in-between teeth without going through the top of the tooth. So they'll say, oh, we have a class 2 filling, but it's going to be an MO restoration. So when I say MO, that's mesio-occlusal. So MO. And it's always just the first letter of whatever surface it is. Okay, so mesio-occlusal distal. That's an MOD. All right, so proximal surfaces on the posterior teeth. So in between on the back. Okay, class 3 is interproximal of the anterior teeth. So class 2 is posterior, class 3 is anterior. Okay, 2 is in the back, 3 is in the front. So this is only the interproximal surfaces. Okay, this is class 4. These are anterior interproximal surfaces on the anterior teeth, but it includes the incisal edge. So this would mean there's decay on the incisal edge in addition to, or maybe a fracture, or as you can see here, this tooth is broken. So class 4. Now, if you aren't familiar with Roman numerals, if the 1 comes in the front, then you subtract it from the whatever number this is. Okay. So if this would be, so 5 minus 1, it's class 4. Class 5, which is just the V, class 5, is the cervical third of a facial surface or the lingual surface. So facial or lingual cervical thirds. And that means these just down right here. When I say the cervical, cervical is towards the neck of or the center of, okay, right at the gum line. This usually happens, this type of restoration is needed for people who brush too hard, that are grinding their teeth, have other issues, they're clenching their teeth, traumatic occlusion. There's a number of different reasons why, you know, they might need these restorations, also from sucking on the candies, or there's a number of different reasons. But basically, class 5 is the cervical third of the facial or lingual surfaces. Class 6, so 5 plus 1. So if it's on the right-hand side of the number, if the ones are on the right-hand side, then you add it. So this is a class 6. And these are worn away due to abrasion or grinding or clenching or just some sort of wear on the tooth. So class 6 is worn away due to abrasion. Okay, so which type of caries commonly occur in a patient that regularly sucks on sweets? And if you remember, we talked about that. Class 5. Class 5. Okay, so now we're going to talk about abbreviations. I briefly touched on that here just a few seconds ago, but the abbreviations of the tooth surface are very simple to remember. As long as you know the words, you're going to be able to figure out what it is. So I is incisal, M is mesial, D is distal, B is buccal, O is occlusal, and F is facial. They did not put lingual in here for some reason. Oh, there's more. Oh, they didn't put it in there. L is lingual. Okay, I don't know why they didn't put lingual in there. Let's go on to this one. Compounds. So these are simple one surface abbreviations. These are compound. So simple is 1, compound is 2. Okay, so compound involves 2 surfaces. So DO is disto-occlusal. MO is mesio-occlusal. MI is mesio-incisal. And it goes on and on and on. Okay, so you kind of get the idea there with that. So if it's 2 abbreviations, it's still the first letter of whatever surface it is. So sometimes you have to look at it for a second and kind of until you get used to deciphering it. I know that I've had the question before, does it matter the order that you put the abbreviations in? And the answer to that is no. It doesn't necessarily, but you usually would work from the midline distal. Okay, so you have an MO or a DO. If it's the occlusal, then it works. I just said that, but I guess I was thinking MOD is mesio-occlusal distal, so you work from the front back, or the mesial incisal, but you wouldn't put an ID, like we have an ID filling. So I guess I would say it would be more so the proximal surfaces first. And if the mesial is included, then I would always start there. But no, technically it doesn't matter. Complex involve 3 surfaces or more, 3 or more. Okay, so we have mesial occlusal distal, or you can have mesio occlusal distal buccal, which that's a quite buccolingual. That's a quite large filling there. You won't see those complex ones that go beyond 3 very often. Because usually if they're needing that much work, they'll probably move it to a crown. But sometimes you will. Sometimes you'll see those complex ones. So simple is 1, compound is 2, complex is 3 or more. So which dental condition presented in this picture is presented in this picture? And there are some people who are very popular out there who have this condition in Hollywood. The London look, I think is what they call it too. But I would question this too right here. Whatever this is going on, he might need to have that checked out. But this is called a diastema. This is called a diastema. It's a space between teeth, basically. The most common is in front of, in the 2 front teeth there. All right. In your book on page 298, there's a long list of charting terms or words that we will use. So I would familiarize yourself with those terms because you'll need to know them. They're all used very often in dentistry. So I would definitely make some flashcards if you don't have them available. There's also some, that's available to you like any other chapter. So basic charting terms is abscess. An abscess is, we've studied that already, but it's basically an infection. A bridge, there are several different types of bridges, abutments, pontic, cantilever, or Maryland bridges. We can go in more detail on those. Abutments are the middle area of a bridge. So what a bridge is if you're missing a tooth, you can put crowns on either side of the missing area and fill it in with a fake tooth in the center. So the abutment is the fake tooth in the center that gives the bridge the span across that empty space. Pontics are the other 2 teeth on each side of it. Okay. So meaning you'll have at least 2 pontics and 1 abutment per bridge at minimum. A cantilever bridge is attached only on one side, meaning there would be a crown and an abutment. And that's it. I'm sorry, a crown, an abutment and a pontic, and that's it. Just one of each. A Maryland bridge it has wings on the pontic, okay? And they're attached to the lingual sides of the adjacent teeth. So you have a pontic, which is the fake tooth, right? And on the lingual side of it, it'll have 2 wings that you put on the lingual side and you cement them on that way. So you don't have to do any type of adjustment to the teeth that don't have anything wrong with them. All right, and then there's a crown, which some people call a cap. Can you just cap this tooth? Can you'll hear a lot of people refer to it, like older people will refer to it as a cap probably. But it can be a permanent or a temporary, just depending on what your office does. If you have a CAD/CAM office, then you probably will not have to make temporary crowns, meaning if you have the ability to mill your crowns in office, which is awesome. It happens very quickly. They can, from start to finish, 3-hour appointments. And I know it sounds like a lot, but it's really not too bad if it's, they take 1 day off of work and then they're done. So that's nice. Denture, you can have a complete, I'm sorry, let me go back. On the crowns, you'll have a temporary crown. So if your office still is sending out your crowns to a lab to be fabricated, then you'll have to fabricate a temporary crown, and you'll do this in the lab during this mod. And it's a really great skill to have because you need to make sure that the margins are smooth. So it's covering the tooth completely. They don't have any leakage, because if they do, once we prep the crown, we've removed all the enamel from the tooth. And so we want to make sure that we cover it up until the permanent one comes in so they're not in pain. So knowing your temporary crown skills is going to be very important. Denture, you can have a complete denture, which is the full arch, meaning there's no additional teeth on the upper or on the arch, upper or lower, or you can have a partial denture, which means you're replacing, several teeth in the same arch, but it's not enough to have a full denture. Okay, diastema, which is what we talked about previously, that's a space in between teeth. Usually during the in between the maxillary central incisors, but not always. Sometimes it's the lower, sometimes it's other places, but that's the most common. Drifting is so all teeth are supported by each other. They're very nosy. Teeth are nosy. They like to touch things. They like to touch other teeth. They want to be with each other, and so they, for example, a tooth will drift if you don't replace it or put something in its spot. So if you have a, let's say your upper right canine, okay, let's say you have to have that extracted, but you don't put anything in its space behind it to hold it, okay, it will start, the tooth next to it will start to drift into its spot, okay. So that means it'll start, let's use a better example, okay. Let's say your lower right first molar, okay, so the first molar on the right side, you have that extracted because you can't afford to have a root canal and a crown or an implant or whatever. But there are other options available. You can do a bridge, or you could do a flipper, a partial denture in there to hold its space. There's a number of different things you could use for that. But the downside to it is if you have that first molar extracted and you don't do anything with it, first of all, the bone loss is going to get greater in that area. Okay. And then the second molar and the second bicuspid they're going to drift forward. Okay. So here's these two teeth and all of a sudden this one's missing. Okay. So they're going to start going like this. And that creates a food trap in that little triangular area that it has created. And so that is very frustrating, and it can cause you to lose other teeth. So drifting is a real thing. Also, so when we bite our teeth together, we have that teeth, they contact each other. So again, if you had that lower first molar pulled, the occluding tooth on the top will start to over erupt into place because it's trying to reach something to butt up against and occlude on. All right. So that's going to cause even more problems on the opposing teeth. So the one above it will over erupt. The other two are going to start leaning and it's just a hot mess. Okay. So it's better if we can put something in there, even if it's temporary, in order to hold that space to prevent any other further issues from arising. Okay, furcation is the dividing point between teeth. So every tooth has a root. Let me show you on this charting thing up here that we did in the very beginning. Or was that the book? That might have been the book. Let me find it. Okay. All right, so this right here, where these two roots connect, this is the furcation. Okay, so right, I can't highlight it, but right in here, this little area is the furcation, wherever the roots separate. Let me get back to my spot. Hang on, guys. Okay, furcation, gingival recession. So gingival recession is when the gums start to recede or go back. Okay, so for example, if you are grinding or clenching or having issues with brushing too hard or a number of other things, though, that's going to cause the gums to recede or go away from. This is usually followed with or preceded by bone loss. So if you have periodontal disease, for example, and you're having a lot of plaque buildup below the gum line, it's going to cause bone recession and then gum recession. So you'll have both of those happening. Gold foil is a restoration created when several layers of pure gold are placed into the prep. I have never in 13 years seen a gold foil filling. It's very expensive and it's just not practiced anymore. Incipient is the beginning decay that has not yet broken through the enamel, meaning there is a cavity there, but it hasn't perforated the enamel surfaces yet. So sometimes you'll hear doctors say, well, I just want to watch this cavity. You know, I want to watch this. It could be incipient decay, blah, blah, blah. It's not something that needs restoration yet at this point. So they'll be watching that. Mobility is every tooth has natural mobility. Okay, when the tooth moves in the socket, that's called mobility. So if you were to push on your tooth right now, it's going to move just a little bit. Okay, if it moves a lot, then you know that's something we need to notate in the chart. But most of the time, it's just a little bit. If it moves a whole lot, that's usually due to trauma, periodontal disease, or other issues. And then you will chart it using Roman numerals from like 1 to 4, basically, the severity of that. And the doctor will tell you, we need to mark a number 2 mobility, blah, blah, blah. And that's something you can enter into the system. Okay, overhang. Overhang is excessive restorative material that's normally found in between the teeth near the gums. That's a hard area when you're placing the matrix or the tophamile around. Sometimes if you don't get a good seal on it, you can have some overhang, and that does have to be smoothed off. Otherwise, it's going to form an area for plaque and tartar to hang on to really easily and food to get caught. It'll also start shredding the floss and other issues and be really annoying for the patient. So anytime we do an interproximal filling, we need to make sure that we are checking the floss. It should glide smoothly and seamlessly up and down the side of the tooth. It should never catch. Partial dentures are prosthetic devices that replace missing teeth. So again, that's just partial. It will replace just a few teeth. A full denture replaces the whole arch. Periodontal pocket is the space in the gingival sulcus created by periodontal disease. The space is measured in millimeters. So when you go to the doctor, when you go to the dentist and you're getting your teeth cleaned and they start calling out 3, 2, 3, 3, 2, or 5 or 7 or whatever it is, those numbers are the pockets that they're measuring. So they're taking the probe, they're sliding it along the long axis of the tooth, and they're measuring the bone level of those teeth. Healthy gum tissue is between 1 and 3. 4s and 5s are considered gingivitis, and anything 5 and above is going to be considered periodontal disease. So 5s can be perio, just depends on the situation. If you, but usually, I'd say 4s. Actually, 4s are gingivitis. 5 and above is perio. What was the next one? Restoration. A restoration is an agent that is effective in replacing a missing tooth structure. So that can be IRM, it can be composite filling, it can be a crown, it can be a gold filling, it can be gold foil, whatever you want to say. It can be a lot of amalgam, anything basically, any type that's restoring the tooth. Root canal. Root canal is when the pulp is removed and replaced with a filling material. Pretty simple. I know we talked about that briefly the other day. And a sealant is a resin material that's used to seal pits and fissures to prevent decay. So, you know, I showed you those would prevent class 1 fillings basically in that very beginning. Let me show you the picture again. Cavity classifications, this kind. If we seal these pits and fissures on the posterior molars, it's kind of a catch-22 on the posterior, then it will seal up these little areas that we can avoid getting fillings. And we do this on newly erupted teeth with kiddos because they have a hard time brushing properly, and they just really struggle in general with that kind of stuff. Their teeth are more susceptible. All right. That was it for the charting terms. Okay. And so and I'm going to show you some examples here in just a minute. So charting colors and systems, red will indicate work that needs to be done. Blue is completed work. And the lines and fill-ins are going to indicate the type of restoration. This is done now all digitally. When we were on campus, we were having you guys do this on paper with red and blue pencils, but now it's done digitally, which I really love because I think it's more up to date and it's actually a better example of what is going on in the everyday world. Okay. In your book, there's some examples of how to draw the symbols if you needed to and what they will show, but I'm going to pull up one of the exercises that I referenced earlier in this lecture so you can kind of see, but there's a lot of pictures that'll show you how to chart specific things. Okay. So red is going to, like I said, it's work that needs to be done. So anything that you're treatment planning, so a new patient comes in, we take a full mouth x-ray series and you're sitting down with the doctor and he's like, okay, there's decay here. There's a broken tooth here. Any of that's going to be charted in red. And so we're going to go over that here in just a second. Blue means it's existing work, or I'm sorry, work that's been completed. So previously completed by another office, or if it's something that we've completed in office, then once we've completed it, it will turn blue. All right. There's a really great picture of the Dentrix software, and I'll do some more of this in class. I'll show you some more actual charting in the Dentrix software. I'm also still working on how to get you guys, for you Mac users, how to have you download this software. It's very frustrating that it's not working properly. I did find some directions, and I'm going to send to that in the email when I talk about referencing this on how to try it. Let's see if it works for Mac users. But this is what the actual Dentrix software looks like. It might vary just a little bit based on version that you have. And so it really just depends, but it'll be very, very similar, meaning you'll have this little area over here on the right-hand side. These are quick buttons. These are more, you can, once you click the little plus signs, it'll drop down and give you all the very specific codes if you're looking for certain things. So I'm going to go over this with you more in class so I can just show you for those of you who haven't been able to download it just yet. And I think that's pretty much it for the chapter lecture. I'm going to pull up, give me just 1 second. Add this in here. I'm going to do one of these with you to show you about the charting. Let me log into my class here and I'll show you. Okay. So if you go under your assignments, and this is not available to you guys yet, I'll put it up on Monday because I don't want you to panic. Or actually, I'll probably make the first 2 available to you so you can play with it. I'll do the 2 adults first. Adult 1, why did this go out of order? It drives me nuts. Adult 1, adult 2, we'll put those up. So I'm going to go to the adult charting, and then you're going to click load dental charting. And we're going to walk through this one together because I really want you to see how it's done. And we're going to listen because it's an audio recording. Okay, so start assignment. Okay, so it'll come up here. Using a series of symbols, numbers, and colors, dental charts provide an invaluable record of patient's oral condition at a particular point in time. The dental assistant is responsible for creating the visual depiction of the dentist's findings and recommendations, which will later be used for diagnosis, consultation, and billing. Okay, so it talks about the 6 classifications, universal numbering system, and all of the stuff that we just reviewed in the chapter. So you're going to listen to it, and then you're going to transcribe the conditions, the completed dental services or recommended services. All right. So we have to listen to how they say the sentences. Is it meaning it has, or it needs, or we'll go from there. I'll explain it a little bit more. Okay, so this patient's name is Alyssa Rubenstein. This is Miss Rubenstein's first visit to the dental office in 2 years. So we're going to listen to the dentist report and fill in the chart to reflect any diagnosis or recommendations. Okay. Now these are going to be used for a grade. So
Number 1 is partially erupted.
Sorry, let's start over. These will be for a grade, but again, they're not due until the end of the mod. Okay, so we have got lots of time to work on it. So don't feel rushed and don't panic. So we're going to listen here. Let me turn this down just a little bit because I didn't realize it was so loud. You can also just read the transcript if you want. I like to listen to it because that's how it's going to be in the real world.
Number 1 is partially erupted.
Great. Number 1 is partially erupted. So let's take a look at this real quick. Let's familiarize ourselves with this chart real quick so we can know what we're looking at. Okay, so we have mark completed work right here. Mark work to do. And erase marks. All right, so these are your 3. This is going to go between colors, how to fix things, and what to do basically. Okay, so this is going to be your home bar or your control bar. This is where you're going to start. Now, they breaks it down into a couple categories. So here is amalgam restorations. So is it a complete restoration, meaning not is it done, but is it a full surface? Is it a cervical surface or is it a pit? Okay, so amalgam, complete cervical or pit. Okay, and then you go over composite, complete cervical or pit. Okay, and then we have other options here for other conditions. Okay, so let's listen again.
Number 1 is partially erupted.
Okay, so first things first, you're going to go, it says number 1 is partially erupted. Okay, so we're going to, it's completed, so it's already there. Okay, and then we're going to go through here and we're going to look, where does it say partially erupted? Okay, right here, partially erupted. Partially erupted. Okay, so we've selected the first 2. It is, so it's completed. It's something it is. Partially erupted, and it's tooth number 1. So we're going to click tooth number 1. And it just pops it up right there, partially erupted. Let's listen to the next one.
Number 2 has a Class 5 restoration on the buccal and a MO amalgam.
Okay, let's rewind that.
Number 2 has a Class 5 restoration on the buccal.
Number 2 has a Class 5 restoration on the buccal. So it says number 2 has, okay, so mark completed, and it's a Class 5 restoration. Let's listen again.
Number 2 has a Class 5 restoration on the buccal.
Okay. Number 2 has a Class 5 restoration on the buccal. So he did not say amalgam, so we're going to say it's composite. Okay, Class 5 is a cervical restoration, and they said on the buccal. Okay, so one thing I didn't review with you, which I should have, but the outside is always the buccal. The middle is always the tongue side. Okay, so number 2 has a Class 5 restoration on the buccal. So I marked completed, Class 5 on the buccal. Let's go to the rest of number 2 because it has something else also.
And a MO amalgam.
And a MO amalgam. All right, so mark completed, and it's an MO amalgam. So we're going to hit, this is an amalgam category. It is an MO, so it's full surfaces. Okay, and then we're going to go MO. Okay, just kidding, that's DO. So I made a mistake, so I'm going to hit erase. Okay, but now I'm going to go mark completed MO. Okay, MO.
Number 3 has decay on the occlusal and distal.
Number 3 has, so needs work, has decay, has caries. What did he say? Occlusal, distal.
Number 3 has decay on the occlusal and distal.
All right. So it has caries on the occlusal, distal. That's it.
Numbers 4 through 6 are okay.
All right, good. So that doesn't need anything. Numbers 4 through 6 are fine.
Number 7 has a composite on the lingual pit.
Okay. Number 7 has, so it's completed work, a composite on the lingual pit. Right? Let's make sure.
Number 7 has a composite on the lingual pit.
Yep. All right. Number 7 has a composite on the lingual pit. So this is has composite pit 7 lingual. Okay.
Number 8 has had a root canal and has a porcelain crown.
All right. So again, has, number 8, has had a root canal.
Number 8 has had a root canal and has a porcelain crown.
So it's had pulpectomy. Okay, so I got that. Has pulpectomy 8 and has a porcelain crown. So now I'm going to select porcelain crown and click 8 again. Done. What's next?
Number 9 has had a root canal and has a porcelain crown.
Same for number 9. Has had a root canal and a porcelain crown.
Numbers 10 through 12 are okay.
Good. Numbers 10 through 12 are fine.
Number 13 has caries on the buccal cervical and an amalgam on the disto-occlusal. Number 13 has caries on the buccal cervical.
Okay. So you can always pause it if it's multiples until we get used to it, okay? Now I already forgot.
Number 13 has caries on the buccal cervical.
Buccal cervical. Number 13 has caries on the buccal cervical. Okay. Let's hear the rest of it.
And an amalgam on the disto-occlusal.
And an amalgam. It has an amalgam.
Number 13 has caries on the buccal cervical and an amalgam on the disto-occlusal.
Amalgam on the distal occlusal. So mark completed because it's something that's already been done. It's a full surface. Distal occlusal. All right.
Number 14 is a porcelain fused to metal crown that has hypererupted.
Okay, so it has porcelain fused to metal crown. So we've already marked completed, porcelain fused to metal, and it's hypererupted. Okay, so I'm going to go a little faster through the rest of these so you guys can just watch where I'm clicking and listen.
Number 15 is hypererupted according to the x-rays. Numbers 16 through 19 are missing.
Okay, so I marked hypererupted.
Number 20 is an MOD.
Hang on.
Number 20. Number 15 is hypererupted according to the x-rays. Numbers 16 through 19 are missing.
All right, numbers 16 through 19 are missing. So we're going to select missing because we're already marked completed, so they're missing. 16 through 19. Okay, so 16, 17, 18, 19. They're all missing. Number 20.
Number 20 is an MOD composite restoration.
Okay, so is a composite restoration. Let's listen again because
Number 20 is an MOD composite restoration.
Okay, MOD.
Numbers 21 through 25 are okay.
Okay, good. 21 through 25 are fine. I don't need that.
Number 26 has a mesial composite.
Okay, so it has some mesial composite. I'm already ready to go. Already has a mesial composite. Remember, when you're charting, remember where the midline is. I'm going to go back and check that one because now I'm questioning that one. Okay.
Number 27 has a porcelain fused to metal crown.
Okay, so it has a porcelain fused to metal crown. So we're still in the blue. Porcelain fused to metal crown.
Number 28 and number 29 both have had root canals and porcelain fused to metal crown.
Okay, so they've had pulpectomies, and they both have porcelain fused to metal crowns.
Numbers 30 through 32 are missing.
All right, and those are missing. So missing.
Numbers 30 through 32 are missing.
Okay, so now I'm going to go back and check number 13 because I want to make
Numbers
sure.
10. Number 13 has caries on the buccal cervical and an amalgam on the disto-occlusal.
I did it right. All right. So remember, if you go straight down the middle, the mesial and distals change, meaning what was the mesial is now the distal, et cetera, et cetera. Okay. Mesial means closest to the midline. Distal means is further away from the midline. All right, so let's submit it and see if I got it right. Oh, I didn't get one right. This one. Let's listen again. Number 2.
Number 1. Number 2 has a Class 5 restoration on the buccal and a MO amalgam. Number 3 has decay. Number 2 has a Class 5 restoration on the buccal.
Okay, so let's erase it and start over.
Number 2 has a Class 5 restoration on the buccal and a MO.
Class 5 restoration. It has Class 5 restoration on the buccal.
Amalgam. Number 2 has a Class 5 restoration on the buccal and a MO amalgam.
And an MO amalgam. Okay, amalgam. MO. Maybe it's not liking that I put that as a composite. So let's change it to amalgam and see if that's what it wants. There we go. I guess it was assuming that it's amalgam. I assumed it was composite. So cool. I got a 95 because I screwed up once, but it is what it is. So that's how you do the adult dental charting. That's how it is on this particular software. And again, on Monday, I will go over it with you, and I will show you how to do it in Dentrix as well. So that's all I got for today, guys. Hope you enjoyed the lecture. Give me your feedback if you like the lectures or remotely or not. All right, I'll see you guys on Monday. Have a great weekend.